I'm okay.
Hi, Georgia.
How are you?
I'm good.
It's pouring rain outside.
It is. It's a little wet at the minute.
And you just public transported it all the way here.
Yes.
Thoughts and prayers
Thanks so much.
were with you. And one text message and your response that I ignored. Very much apologise.
That's fine.
I did intend to get you from the bus stop and then I forgot about it.
It's all right.
Apologies. I
I'm
was
an
too
independent
busy
diva.
watching Donald Trump talk shit on the internet.
Oh, fuck's sake. What's the pumpkin on about now?
Well, he's just saying more of the bullshit that he always says, that they're obliterating Iran and all is well and the war's going to come to an end very soon and they want to make a deal. They want to make a deal with the hands, like...
The hands.
The hands. Meanwhile, Iran's sending out propaganda videos of them bombing the fucking Statue of Liberty that has a fucking cow's head with horns. Like,
Go.
and the children of all the fucking indigenous people looking up at the sky in admiration of the bomb flying over them to kill the US or some shit. Like it's...
Sure. Great.
It's fucking
It's going
hectic.
off me.
It's
It's going
so
off me
hectic.
given I fly to the US in 20-something days.
Whoa. You're still going?
Currently, the trip is not yet cancelled. The competition is not yet cancelled.
Oh my God. No. Do not go. Where are you going?
Florida.
Florida.
Yes.
Florida.
Look, if Disney World gets bombed while I'm there, at least I'll go out in the happiest place on
In
earth.
style. Yes.
Doing the thing I love most, so
Theoretically happy, hopefully.
theoretically.
Nah, I think you'll be right.
Yeah. White girl I'm straight passing, I'll be all right.
Are you though? The blue and pink hair gives it away a little.
It won't be blue and pink when I go.
Okay, what are you dyeing it to?
It will be like dark green
Dark green.
and with like yellow money pieces to
'Cause
match my
that's better.
Team Australia uniform.
MAGA people will clock you. They will clock you. They're like, she's got different colour hair. She's a leftist.
She's got piercings. Yeah. Yeah, look, I'm going to get clocked. It's fine.
Yeah, that's fine. Who cares? Make them uncomfortable, Kay.
Exactly. I'm not here to make people comfortable with me. If they don't like me, they can fuck off.
Yeah, fuck right off. Is Florida a lefty town? Do you know? I don't know.
It's a state.
Yeah. There's lots of hurricanes and tornadoes
There
in
are.
Florida, so there's also that.
There is also that. Lots of alligators, apparently.
Not trying to scare you or anything.
That was fine.
Word
Nothing
vomit.
happened.
Yeah, how was it last year? Good?
Last year was good. It's hot. It's hot there.
Okay.
But I think being from Western Australia where it is quite hot in summer, especially compared to here, I did all right. A little moist, but yeah.
Moist.
Moist.
I fucking hate humidity.
A little bit. I don't mind it.
I'm just asking ChatGPT if Florida's red or blue.
I'm pretty sure it's red. Pretty sure
Red
it's red.
state, yep.
Yeah.
Oh dear, well, thoughts and prayers.
Thanks so much.
Let's pull a fucking tarot card for
Let's do it.
Kay's trip. I haven't actually got these out. We need the universe on our side currently, I feel. Although I don't think I'll be able to shuffle this deck, so. Thumbelina Tina is my thumb brace. It is currently a silver peg-looking contraption on my thumb because I sliced my fucking thumb open with a knife as I was sharpening it the other day, and I was doing it the complete wrong way. I should have been doing it away from me, apparently, but I wasn't. I went straight towards me.
I mean, that's like a natural movement. That's not so much. So I can understand.
And I was trying to think of the way that I saw my mum's partner do it when he gave me the fucking sharpener. I swear he did it towards himself, but maybe he didn't. I don't know.
I'm mildly offended that you have an ED nurse friend and you didn't even text me.
I was, yeah.
Hey, I saw the videos. You handled it yourself.
I
You're
did.
fine.
I did.
Independent diva. You sorted
Dairy
yourself
strips.
out.
I am qualified in registered nursing.
You are.
Surgical, to be exact. So,
Will you be renewing that in May?
Yeah.
Yeah.
I will be,
Yeah.
because I don't have any fucking alternative at the minute
Fair.
until I finish my MUA course, which is currently going, still doing it.
Still going?
Still painting
enjoying
my
it?
own face. Yes, but the ADHD is kicking in and I'm getting a bit bored.
Fair.
You know?
Yeah.
And I knew that would happen, so I just have to fucking push through and stick to it and then I'll be right.
How long have you got left?
It's a 6-month course and I've done like 2 modules.
Okay.
I don't know how many there are, so I'm just plodding along. I need to get back into it. All right, we've got the Knight of Pentacles manifestation. I don't know what that means. I'll open my little guide here after my very shitty shuffle. Okay, meaning practicality, hard work, and commitment. The Knight of Pentacles indicates both fulfillment and overcoming difficulties. As an individual, he is stoic, reliable, and helpful. As an energy, this is a time of responsibility and hard work that will, by rights, lead to the successful conclusion of a project.
Hey, all right.
That kind of works.
That actually really works.
It urges you to keep doing what you're doing. Oh, well, that's a good sign. That means you're supposed to go.
Excellent.
Hopefully.
Great.
Tried and true methods are favoured. Now is not the time to strike out in an entirely new direction.
Don't plan to.
Stay on the path.
Okay.
There is a recognition of responsibility. Because you're the fucking coach, aren't you?
No.
Oh, I thought you were.
I am a coach. I'm not a coach of this team.
Okay. Think hard work, responsibility, and continued perseverance. All right. We are manifesting a win.
Yeah. I've got 2 teams, so I've got 2 chances.
2 times wins. The other thing we're manifesting is the worst segue in the whole world. But anyways.
I'm excited. I can't believe I forgot till this morning to be like, wait, do I need to prepare?
I was going to play a joke on you, actually, and then you asked, and I was like, oh, fuck. Because I was going to be like, so what have you got for us today, Kay? And just watch you squirm for a little bit.
And I ruined it.
You did. So
Sorry.
I felt bad because then you would actually prepare something, I know. You'd do the full ADHD cram session, just like
absolutely
smash something
Which is
out
why
on
I
the
was
bus.
like, I've got time.
I've got 40 minutes. It's fine. Righto. Well, over the next few episodes, we're heading back into familiar territory, the kind of stories that make you double check your own doctor's name before you sit down. Because as much as we want to believe the people treating us are safe, competent and ethical, that's not always the reality, unfortunately. So I think I said I'm joined by Kay, but if I didn't,
hello.
She's an ED nurse and occasional voice of reason and chaos. As we unpack some of the more unsettling cases to come out of the healthcare system in this new series. We're focusing on Melbourne and looking at the cases that slipped through the cracks, the doctors who were trusted, respected, and in some cases still practicing, while serious allegations were building behind the scenes. These involve criminal charges, malpractice, and decisions that had very real consequences for patients. This series isn't about fear-mongering, it's about awareness, because when systems fail, it's the patients who pay the price, hey?
Correct. And I think it's good for everyone to be aware of what's going on in the health industry that we're living in, working in, existing in, experiencing.
That's it. This one is a request from one of our listeners, Jess.
Okay.
And she requested this a few months back, so sorry it took forever to
But
get
thanks,
this.
Jess.
Yes, thank you very much, Jess. So let's get into it. So the God complex. Some people call it confidence, others call it brilliance, but in medicine there's a line where confidence stops being protective and starts becoming dangerous. They call it the God complex, not because these doctors think they're gods in some dramatic, obvious way, but because over time they start to believe that they are the final authority. I've seen that many a time.
Every year the new interns rotate in.
Every year. The one who knows best, the one who doesn't need to be questioned. And in surgery, that belief carries so much weight, and I see it so often. Because when you're the person holding the scalpel, people typically don't argue with you unless they're on your level. They trust you, they defer to you, they assume that every decision you make is grounded in evidence, in necessity, and in the patient's best interest and the team's, right? Most of the time, the trust is deserved. But when it isn't and confidence turns into certainty and certainty into control, that's when the dynamic shifts. Not all at once, but in subtle ways that are easy to miss until you start looking more closely. And in my experience, once you see it, you can't unsee it, a toxic culture. In the operating room, after we perform a surgery as a team, the surgeon is often asked for what is known as an MBS Medicare Benefits Schedule number. Have you ever heard of that?
Rings a bell.
Yeah, see, I hear it every single day. What's the MBS numbers? Before the surgeon runs out of the fucking room.
Fair.
But an MBS number is a specific item code used to identify a particular medical or surgical procedure, which determines how much Medicare will reimburse you for that particular surgery. It's basically the price tag code for a procedure in the Australian healthcare system. Medicare then uses that number to decide how much money gets paid back to the patient or provider. Now, why am I even fucking talking about numbers? Because MBS item 35641 is the code for severe endometriosis laparoscopic resection.
What was it? 35461?
35641.
641.
Close. So close. So keep that in mind for a point I'm going to make later. But for right now, we're going to talk about Dr. Simon Gordon. Do you know that name?
I've heard it. I've definitely
Been in
heard
the
it.
media hugely for the past year. Been practicing for years. He's a very well-known gynaecologist. So, for over 2 decades, Gordon worked as a Melbourne-based gynaecologist, specialising in lap or keyhole surgery for endometriosis. He operated through Epworth Private Hospital and his private clinic, Endo Health. And according to reporting by the ABC, he treated more than 13,000 patients since the late 1990s.
Okay.
So that's a lot. Detailed records of his early education are not widely published. His scope of practice and his registration with APRA indicates he had to have completed training in obstetrics and gynecology and develop a subspecialty focused in advanced lap surgery.
Okay.
Essentially, he's qualified, we think.
Does it not say on APRA? Because I know if you look it up, it should say where they... I haven't really looked at
I
doctor up.
can't look it up because he's no longer registered.
Oh.
But yeah, maybe. Not sure. Because it definitely says your qualification.
Yeah, because
But
like
it's
when
not where you studied.
when I look myself up, it says where I've studied, which
Really?
uni I went to, when I finished, and my first year registration and where I'm registered, so Melbourne.
Okay.
I don't know if like deregistered people are listed though.
I found him on LinkedIn. Let's have a look.
What does this LinkedIn say?
Okay, there we go. Leading specialist in advanced lap surgery for endometriosis, complex cyst pathology and chronic pelvic pain, University of Auckland. I found it, guys.
University of Auckland, New Zealand.
He was a fellow of the Royal Australian and New Zealand College of Obstetrics and Gynae and a member of the AGES, which is the Australian Gynecological Endoscopy and Surgical Society. So there you go. He studied between 1983 and 1989. Anyway, back to the story.
Anyway, yeah, sorry.
No, you're good. Within the patient community, particularly among those with endometriosis, he developed a reputation as a high-volume surgeon, often seeing patients who had not found relief anywhere else. That reputation, combined with the volume of patients he treated, is what makes the subsequent allegations and investigations particularly significant, because this wasn't an unknown practitioner operating on the margins of the system. This was an established specialist working within major private hospitals with a large patient base and a long-standing career and reputation. So, drama.
Yeah. And he'd have a lot of people that really respected him and liked him for what they did for them.
Yes,
Yeah.
that's right. He'd probably have glowing reviews as well as
Yeah.
the complaints that have been made against him.
Yes.
Also, it's like pouring rain, so sorry if you can hear it.
Melbourne weather really do be Melbourne weathering today.
Oh my God, it so is. So before we get further into this case, we need to talk a little bit about endometriosis in case we have any non-medical listeners, because understanding what it is and how it's supposed to be diagnosed and treated is key to understanding why these allegations are so serious. Endo is a chronic condition where tissue similar to the lining of the uterus grows outside of it, commonly on the ovaries, fallopian tubes, and other structures within the pelvis. It can cause a range of symptoms, including severe pelvic pain, painful periods, pain during sex, fatigue, and in some cases infertility and bowel issues. It's also a condition that's notoriously difficult to diagnose. There's no simple blood test for endo. Imaging like ultrasounds or MRIs can sometimes suggest endo, but they don't always pick it up, especially in milder cases. The gold standard for diagnosis has traditionally been lap surgery, where a camera is inserted into the abdomen to directly visualise any lesions or adhesions. During that procedure, surgeons may remove a biopsy of tissue, which is then sent for histopathological analysis. That's a big word for Elmo. To confirm whether it's actually endo. And that part is critical because while surgeons can suspect endometriosis based on symptoms, the diagnosis is ideally confirmed by pathology and what they see in the surgery. But the diagnosis is ideally confirmed by pathology results, meaning the tissue under the microscope shows features consistent with endometriosis. Does that make sense?
Yes.
Yes.
And from what I've heard, it can take 7 to 10 years
Yes.
for a woman to get a diagnosis.
Yes. Yep. It can.
Yeah.
'Cause we're ignored, but we touch on that.
Sorry.
No, you're good. No,
jumping ahead.
no, please jump in. Treatment varies depending on severity and patient goals, obviously. For many patients, first-line treatment is conservative things like pain management, hormonal therapies such as the oral contraceptive pill, and a hormonal IUD. Can I just say, contraceptive pill really does work for some people. Like, it's really quite helpful. And so it really is the first line that you go to. But if you've got severe endo, it's not going to...
No. And then if you're at a point in
rid
your
of
life
it
where you're
all.
also then trying to get pregnant, can't really be on the pill.
Yeah.
And then you're still
That's
suffering
it.
with all your symptoms.
Correct. Yes. They come back tenfold.
Yes.
So, and as you age, they get worse and worse because
I've
I
heard
think
that.
that the disease advances,
Yes.
obviously. Like,
Yeah, like the adhesions grow back, so you can still have an op and have it all taken out.
Yes.
And they just grow back.
that's it. Yeah.
Grow back like a fungus and spread everywhere.
Yeah, pretty much. Fungus.
Sorry.
Surgery is usually considered when symptoms are severe. Other treatments haven't worked or fertility is a concern. Yeah. Even then, the aim of surgery is typically to remove visible endometriosis while preserving as much normal anatomy as possible. But you can imagine the damage that surgery would even do. And often adhesions then form around the scars of surgery. Yeah. Radical procedures like removing ovaries or the uterus are generally reserved for very specific cases, often when other treatments have failed and after careful discussion about long-term consequences, including infertility and early menopause. And that's where informed consent becomes essential. Patients should understand what is being removed, why it's being removed, what the risks are, and what the long-term outcomes could be. Because once organs like the ovaries or uterus are removed, that shit's permanent.
Yeah.
Like, there's no going back after that.
You could freeze your eggs, but that needs to be decided
And done
in
beforehand.
advance.
Yes,
Correct.
yeah.
But then there is, if you've got no uterus, no womb, no baby.
No.
No baby in you, at least.
Yes. Adoption or
surrogacy.
surrogacy. So when you hear cases where patients were told that they have had severe endometriosis, underwent multiple surgeries and then pathology didn't support the diagnosis, that's just not a difference of opinion. That's where serious clinical and ethical questions start to arise, and that's what happened in this case. So, according to multiple ABC News investigations, including a 2026 Four Corners report, concerns about Simon Gordon's practice began to build over several years, roughly between 2020 and 2025. These concerns weren't isolated. Complaints were reportedly made by patients, other gynaecologists, and hospital staff, and were directed to Epworth Hospital Management, the Australian Health Practitioner Regulation Agency, or AHPRA, and the Victorian Healthcare Complaints Commission. These concerns centred around a pattern which was patients being diagnosed with severe endo, undergoing surgical treatment, and then experiencing outcomes that didn't align with that diagnosis. One of these patients was Mary Spanos. According to ABC News, Mary underwent surgery with Gordon in 2020. And was told she had severe endometriosis that had to be removed. Mary went to see Simon Gordon and she said that he essentially badmouthed her previous surgeon and told Mary that the previous surgeon hadn't got all the endo. I've seen that before. Doctors bagging doctors, nurses bagging nurses, doctors bagging nurses, nurses bagging doctors.
We all bag each other. Even I'm guilty of it sometimes.
Yeah, everyone's guilty of it. She came out of the surgery and she said that she felt in much more pain after the surgery than she did before. Okay, well, you've just had surgery.
You've had surgery.
Yeah,
you're going to have some pain.
Yes. She didn't feel very validated by Simon Gordon, as we just invalidated.
Yeah.
Sorry,
like,
Mary.
to be fair, he doesn't sound like he's going to be a very
Apologies, Mary.
validating person.
God, complex surgeons typically aren't.
No.
But, you know.
My gynecologist was.
That's
That
good.
took my giant tumor out. She was a woman, though.
Yes.
That's
We'll let the silence speak for itself.
Yeah.
Anyway, she said that she felt he was being dismissive of her pain and that made Mary quite angry. And
Fair.
I would, same.
Valid.
I would feel the same way.
Yeah.
She requested her histopathology and the histopathology showed no sign of endometriosis. There were 5 separate pieces of tissue that had been sent off to pathology and all of them came back saying no endo present at all.
Interesting.
And his handwriting was right next to it saying nil endo. So he knew.
He knew.
Mm-hmm. Her case was reviewed by Professor Thierry. I can't pronounce this. It's French. Thierry Vancali, a senior gynaecologist who told the ABC that the surgery appeared unnecessary and caused more harm than benefit. So when all of these complaints started coming out, they then asked the patients for their medical records and reviewed them, and then asked
Had experts.
other senior gynecologists and experts. And this guy is considered to be the father of gynecology, Thierry Vancus.
So not only has this poor woman had to endure surgery, she's done it in the private sector. So either she's paid out of pocket or her health insurance is paid.
Yeah.
And health insurance probably didn't cover all of it because,
Yep.
you know, health insurance feel about
Correct.
gynecological procedures.
Correct. How do they feel? I don't know this.
Oh, some, this is probably generalising a little bit, but depending on your cover, and depending on what it is, it's elective.
Okay.
If you don't have elective cover.
Yes, especially in America, I'm sure.
Yeah, probably.
It's probably slightly better in Australia, but...
Ours are usually like decent-ish.
And Mary wasn't alone. Another patient, who was known as Courtney Payton, also featured in ABC reports. By the age of 25, she'd undergone 7 surgeries under Gordon's care, including the removal of both ovaries and uterus.
Wow.
Yeah, so Courtney is now infertile for supposed severe endo. And she didn't know this until she was requested her pathology by ABC.
So she thought she still had a uterus and ovaries?
No, she knew that they'd been removed. She didn't know she did not have endo.
Oh.
Right? She didn't find out until she had her reports that she didn't have endometriosis on the samples for the operation again and again and again. Everyone but one. There was only one operation, which was her second, in which there was a sort of microscopic tiny amount consistent with endo, but not severe endo, for which she had surgeries and she had organs removed. And it certainly wasn't in any of the others. Her materials were sent to the professor as well, and he told her that the surgery was unnecessary, and he felt sickened that it happened because she's now infertile.
She had 7 surgeries for something that didn't need operating on.
It's terrible.
And at 25, she's now infertile.
I know.
And can never carry a child.
She later said that the opportunity to have kids had been taken away from her.
Yes.
Then there was Abby Lewis. In 2024, at just 21 years old, Abby was scheduled for surgery to remove an ovary. But as reported by the ABC, a fertility specialist advised that the procedure was not necessary. Abby chose to not go ahead with the surgery.
Excellent.
Thank God.
Good on her.
Yes.
Smartest decision a 21-year-old could make.
Yeah. She later discovered that, like other patients, her pathology did not show endo. She has since gone on to become pregnant, and we are happy for her.
We are. Congrats, Abby.
As more cases were reviewed, other doctors began speaking publicly as well. Gynecologists, and these names I'm so very sorry, including Dr. Shamitha Kathurising and Professor Thierry Vancali, reviewed patient cases and raised concerns about whether surgeries were clinically justified. They described outcomes that, in their view, caused harm rather than benefit. Some clinicians told the ABC that concerns about Gordon's practice had become an open secret within parts of the medical community because people clock stuff on the job. Like,
there would have been like techs and
educated.
your anaesthetists and things that
went, well, that's weird.
Yeah.
Well, that's a strange move. Don't really understand that.
Or
Clinical decision. Yeah.
What is it? The scrub scout that's in there holding the tools and passing stuff?
Yep.
I don't know.
Yes, scrub scouts.
Would have seen things and been like,
definitely.
I don't see endo.
That's not normal.
Yeah.
Yes.
What is this? What's this man doing?
Yeah, from what I've seen, endo just, to my eye, looks like normal flesh, but it must look different to the uterine, the tissue separate from the uterine lining. Like, I don't know. I don't know. Like, from the bits that I've seen pulled out, it looks like any other bit.
It's just like extra that shouldn't be there.
Yes.
Yeah.
Yeah, but I mean, to a surgeon, they have to identify it to pull it out.
Correct.
So, yeah.
And you'd think with all their years of training and knowledge that they would know what it looks like and they know they're pulling out the right thing. So like, homeboy knows what he's doing. I don't know, I'm just an ED nurse.
Yeah.
It's on the outside,
and
it's not supposed to be.
I'm a perioperative nurse, but still, I'm not trained in the different textures
that's fair.
and colours of flesh. I just do the anaesthetics, okay? Don't come for me.
It's on the outside, it's not supposed to be, refer it somewhere else.
Yes. And this is where the case becomes bigger than just one practitioner, because according to these reports, complaints were being made over a period of years to multiple levels of the healthcare team, and yet the surgeries continued. That's the most frustrating thing I find with these cases. That
Were Epworth allowing him to continue operating while these complaints were coming in?
Yes.
Interesting.
Yes.
Interesting.
I mean, it's probably nuanced. Like,
There's probably a lot more to it than we know.
it's not like...
And they can't just be like, oh, there's a complaint, you're not allowed to operate anymore.
Yes,
like,
correct.
Yeah.
ABC reporting states that Epworth Private Hospital became aware that Four Corners was investigating Gordon's practice. Within days, he was asked to go on leave, and shortly after, he retired from the practice.
Of course he did.
Yes. Then in February 2026, the investigation became public. The ABC Four Corners program aired allegations that Gordon had performed surgeries for severe endo in cases where pathology did not support that diagnosis. The program also raised concerns about the removal of reproductive organs in young women and the long-term consequences, including fertility and chronic pain, and that show was called God Complex. Following the broadcast, as reported by the news, the Victorian Premier Jacinta Allen referred the matter to police.
Fair enough.
Yeah, stating that if unnecessary surgeries had been performed, it could constitute criminal conduct.
Yeah.
The Federal Health Minister also publicly described the allegations as sickening, and that's why we need investigative reporters, ladies and gentlemen.
Absolutely.
I
why we
said that
need
in
them.
the last case too, but it's true. Like,
Would it not
shit
be
doesn't
almost-
get done until there's a massive hoo-ha about it.
Correct. And could he not almost be done for assault? Like, I know
Yes,
he technically
it's
gets
yes,
informed
yes.
consent.
Yes.
But that informed consent
Yeah.
is kind of coerced
yes.
because he's telling them they have something they don't.
Yes.
And then taking out their organs or
Correct.
performing surgery on them.
Yes.
Which,
Yeah, you're essentially
I don't know the
maiming
legalities
them.
of assault, but
Yeah.
it feels like assault.
Yeah, it feels that way, yeah.
To convince them to let you do an invasive surgical procedure that hasn't got any basis.
I think
based on
there's
their
been people in the
diagnosis.
past who have been charged with assault for...
Yeah.
I think Paolo Macchiarini was...
Yeah, he was.
He
Yeah.
was charged with assault, yeah.
Yeah.
For his fucking shit tracheas. Oh, God. Bits of plastic that they just shoved in there and let rot inside them.
Literally
anyway,
let
check
rot.
out that episode if you want context. Anyway, at the same time, Medicare began reviewing billing practices linked to endo procedures, the MBS codes, particularly the use of item numbers for severe cases. By early 2026, the scale of the situation was becoming clearer. According to reporting, more than 100 women had come forward. 100 women.
Wow.
That is crazy. Multiple law firms began investigating potential legal action.
Great.
And at least one firm reported that over 80 patients had contacted them regarding possible claims.
Wow.
Oh my God, you'd be shitting your pants.
Yeah.
AHPRA also launched a large-scale investigation requesting access to thousands of patient records. Gordon has since surrendered his medical license and registration or whatever.
I mean, he's like, I'm retired. I don't need it anyway.
Yes, yeah,
It's probably his mentality.
yes.
Yeah.
The question is, how the fuck did he go on for this long? Like,
Correct.
if he is
Like, how were
guilty of these things, obviously,
Correct.
caveat, he admits to no wrongdoing.
Of course he doesn't.
There has been no final legal findings at this stage, and Gordon denies any wrongdoing. According to reporting, he maintains that his treatment decisions were made in an effort to improve patient quality of life.
How? Anyway.
This was cited from the hospital, the busiest lap surgeon at Epworth, which is the largest private hospital in Victoria.
Yes.
He was renowned on social media, and he was seen as a sort of guru. He was, like...
So his ego was like, up fucking here.
Yeah, most likely, Kate.
Yeah.
Simon Gordon refused an interview with Four Corners.
Of course he did.
Yeah.
Of course he did.
He did release a statement which said essentially what I've already said, that he only ever did these surgeries if it was necessary to alleviate women's pain. His view is that endometriosis has been ignored for a long time and women felt their suffering wasn't validated, and he was seeking
That's
to
correct.
validate the suffering. He's using a correct fact,
Yes.
if he is guilty of this. He's using a correct fact to justify his incorrect
and
actions.
to twist things to go his way.
Yes, it's a full emotional manipulation there.
Correct, yes.
But, at what point does validating suffering tip over into something that's really concerning? Like, certainly the Federal Health Minister, Mark Butler, feels that. He said, quote, "It goes without saying that these women have been let down by the system, and really our job now is to determine how we can ensure this doesn't happen again, and how, if these allegations are proven, this person is brought to justice."
Yes.
I will say, once the Four Corners investigation came out, everyone did their bit. The Medicare, APRA, the Health Minister, Jacinta Allen,
It just took putting it in the public eye for them to do it, which it
Epworth,
shouldn't have to. But
yes.
Hey, if that's what we need to get shit happening, then put everything in the public eye.
Yeah, I guess. But also, I wonder, how did Four Corners get away with not being, sued for defamation? Because obviously this has impacted his career. He was forced to resign. He may very well not have if this wasn't brought, into the public eye.
I mean, is there a private suit for defamation going on in the background?
Could be.
It could be. Or it could be that he knows he's not going to win a defamation suit because he knows he's guilty.
Yeah.
The investigation's pretty much shown that there were people that didn't need endosurgery that had endosurgery.
Yeah. Yeah, and there's evidence.
Taken out organs.
Yeah.
Yes, that is defaming him.
Yes.
But it's accurate.
Yeah. Yeah. True.
Can't argue with those facts.
I know. It's just that rich white man.
Yes.
They love to sue.
Is he a white man?
Yes.
Yes.
Old as well.
Of course he is.
If these allegations are proven, this person needs to be brought to justice, he says.
Yes.
And that being said, remember the MBS numbers I mentioned at the start?
Yes.
I did a little sleuthing. So the MBS item number, 35641, is the number for surgery for severe, stage 4 or 5 endo, right? Is 51V in Roman numerals?
No.
Is it 4? Okay, stage 3 and 4 in endometriosis. Why do they use Roman numerals anymore? It's 2026.
Right, just use...
For fuck's sakes. Mate.
Just use numbers we can all read.
Just seeking to make my life difficult. Anyway, this means deep infiltrating disease, often involving bowel, bladder, uterus.
Yeah.
Fallopian tubes and all that. They are technically complex, longer operations, usually confirmed with imaging and intraoperative findings like specimens. It's not meant for mild or routine endo, that code. There's other codes for that, and it's a cheaper operation. Do you get what I'm saying?
Because it would probably take less resources. It would be shorter.
Yes. Yep. Less testing.
Yep. From
the official Medicare benefits schedule, the schedule fee for 35641 is $1,449.70. So that's the price of the surgery. Medicare pays 75%. So per surgery, Medicare contributes $1,087. That is the baseline payment tied to that MBS number, right? Yep. That sets the standard of pricing that the surgeon sets.
Yes.
So they go, what's the MBS number? I need to price around there.
Yes.
But some surgeons, it's not necessarily what the surgeon earns. Some surgeons charge above and beyond that MBS fee and sort of class it as a minimum.
This certain man does.
Yes, he does.
Yes.
If he charged only the MBS fee or around there, the total fee would be $1,449. Medicare pays $1,000 of that. Patient pays around $360 for the surgery. And the surgeon earns $1,400 in total, right?
Yes.
If he charged above the MBS fee, which is the most likely outcome in private hospitals, a lot of them do it.
Yes.
This is where things change a lot. A realistic private hospital scenario removing severe endo would result in a surgeon fee of around $5,000 to $15,000. It varies massively, but...
Old mate probably charges the $15,000 range because he's... Yeah. So Medicare
still pays $1,000 of that, but then they're left with the rest.
Yes.
You know what I mean? So
they're either paying out of pocket
he can bump it up a lot. This means the surgeon could often receive several thousands of dollars per case. So essentially billing that item equals higher rebate, which the surgeon uses as a justification to bump up the fees. And he did that.
Of course he did.
For every one of these cases.
So he's earning $10,000, say, per case. And he probably operates a couple of days a week. Yeah.
I wonder, actually, I might see if there's an available payment. What did Mary pay ChatGPT?
ChatGPT, tell us.
One patient reported paying $13,500 for a simple lap surgery. This included surgeon fees, anaesthetist fees, hospital stay.
Just what he made.
She had to borrow money.
Yeah.
Another patient underwent 7 surgeries.
Yeah.
She's paid a total of $32,000 in total.
Wow. For 7 surgeries and to have her organs removed that she could have kept.
Yeah. Yeah, that's crazy. So thousands of dollars. So we can assume that he was doing that.
Yeah. And if he's obviously also charging clinic fees and then operating, maybe having 2 days or 3 days of surgical list, man's rolling in it.
Yeah. He's off retired somewhere on a beach enjoying.
Yeah, probably. Has he fled the country?
I think so. Wait,
Wouldn't surprise me.
Good question, Kay.
Sorry.
No, you're good. Where is Simon Gordon now?
Surely he's fled the country.
They often do.
I wouldn't lie, I would. Not that I'm scamming patients. I work in the public health system. I ain't scamming nobody. Barely getting paid.
It's publicly unknown and not disclosed.
He's fled the country.
He's stepped out of public view.
Look, fair.
Yeah.
I would too if I was under scrutiny.
Yes, I would also. I would disappear under a rock and never return. Endometriosis exists within a healthcare system that has historically struggled to take women's pain seriously. And this is what I was getting at before. Endometriosis affects around 1 in 9 women, and yet on average it still takes years to be diagnosed. Not just because it's complex, but because for a long time the symptoms have been normalised, dismissed and explained away.
The amount of people that, I've heard having severe pain with your period is actually not normal.
No. But severe bleeding as well. Heavy bleeding.
But we are programmed and told this is normal. This is
fine. It's just heavy.
Yeah, this is what having a uterus is. And that's not the case.
Just get a more absorbent pad, change the tampon more often. And it's like, dude, I'm hemorrhaging at night. I cannot get through the night without bleeding into my bed.
When I was diagnosed with I had a 10 centimetre fibroid that I had taken out a couple of years ago. I had an open myomectomy because they were concerned it was turning cancerous. Yeah, back in 2021, so height of COVID as well.
Who did it?
I had done it at the women's.
Oh, beautiful.
With a lovely female gynaecologist.
Period.
Yeah, she was a diva. We like her a lot. But yeah, trying to get diagnosed with that in the public system and just being told... they found it eventually because I had severe lower abdomen pain. I had awful periods for years.
Poor thing.
And I have a history of it. So 80% of women have fibroids and they don't affect them. I was like, cool. Mine's affecting me. And so by the time they found it, they were like, okay, this is probably a problem. And I was going through I was at a different hospital and they're like, we're going to refer you to the Royal Women's, which if you don't live in Melbourne is basically female obstetrics, maternity hospital. In the city and we're going to refer you there. We're going to discharge you now from this hospital. And I was like, okay, but you haven't actually sorted my pain.
Yeah. Hello. I hurt.
The pain is still here.
And
it actually got to a point where the doctors came in, they're like, is there something going on at home? Why don't you want to go home? And then turned it into my mental health. I was like, there is nothing going on at home. Number one, I live alone.
Crazy.
Me and my cat, I want to get home to my cat, my very elderly sick cat that I wanted to get home to. Yeah. But I have a giant tumour in my uterus.
Crazy.
That is causing me so much pain and discomfort. You've not actually fixed my pain. And I'm not eating great because I couldn't stomach food. And they're like, but we saw you eating. I was like, yeah, because I'm fucking hungry.
I'm dying of starvation.
But I can't eat because this pain is so bad. I'm just that whole deal. I'm bawling my eyes out. And they're like, so what's going on at home? Why don't you want to go home?
This is what I'm saying.
And they offered me a psych review. And I'm like, I don't need a psych review. I need you to fix my pain.
They're literally...
Yes, you're referring me to the people that are going to help me. Great. In the meantime, until I get that appointment, because also we're going through the public health system during COVID. And they were like, off you go.
Do you feel mentally unwell? Because I do right now. It's a pandemic. I'm depressed.
Correct.
They're literally judging you by your coloured hair. I swear to God, it happens. It happens.
They were.
Yeah.
They were.
Don't expect to get any medical treatment in the Americas.
No, I don't plan to need it, to be honest. I'm going to avoid American hospitals.
You're literally doing cheerleading. How many people fucking break themselves doing that sport?
I was so sick last time. I'm pretty confident I had pneumonia or something. I was hacking up a lung, just taking short, shallow breaths.
So was I. Something in the air.
Something in the air. And the program lead of my team was like, I will pay for you to go to an urgent care or something and you can pay me back when your health insurance gives you back money. And I was like, I'm not going to a health system in the States.
No.
I'm not doing it. I will tough this out myself. I know enough about my health and medical things and pneumonia.
Do you want to hear something
make this happen?
Fucking insane?
Yes.
When I went to LA, I got tonsillitis, and this is something that I suffer with a lot, right? And I spoke about this on the Epstein episode with Beck because we both went together. And I got really awful tonsillitis, and I got it to the point where I was really suffering in severe agony. So I took myself at like 2 a.m. or whatever. Oh no, I felt it coming on firstly, right? And I took myself to an urgent care, and it was kind of like a clinic.
Yeah.
Like just a doctor's office.
Yeah.
But it was called, urgent care. And I saw this doctor, and he was like closing up shop or whatever. And I was like, oh my God, please. Like, yeah.
Please.
No, this was in the Arvo. But
Okay, yeah,
he was like, look, I can give you a shot of penicillin in your ass right now, or you can come back to my place and I can lance your tonsil for you. Because
Place as it is home?
like, yes. Like a shit you fucking not. I was like, no,
That's how you get murdered.
Thank you so much, but no, I don't want to come to your house.
Negative.
Like, that's so strange. I'm like, is that...
I was sitting here
thinking, I was like, is this literally what's done here? Like, do they do back alley shit? Because I can see that as a thing as well.
Oh, yeah, probably.
Because he said, if you come back to my place, I've got all the surgical stuff there. I used to be an ED physician or whatever, and I've lanced many a tonsil. I've got all the stuff there, and I won't charge you as much as they will at the hospital. So I wonder.
They've got to be doing some back alley shit, because then he would also pocket all of that.
Yes, he would. So he would benefit, I would benefit, except if he's a fucking serial killer,
Correct.
then I would be dead. So I said no.
Fair. Did you get a shot of penicillin?
No, I fucked off. I got spooked.
Fair enough. Valid.
Actually, I think he gave me some oral penicillin, but that did fuck all because I've been getting tonsillitis since I was fucking 13. So
have you thought about having your tonsils removed?
Yes.
No one will do it?
I just haven't done it.
That's fair.
I'm
That's
scared.
fair.
I know exactly what the recovery is like.
That's fair.
For
We get so many
tonsillitis
post-tonsillectomy bleeds.
in adults. And it is not nice, and I do not want a tonsillectomy bleed.
We get so
or
many
a scab in the back of my throat, because I feel like I will vomit and then I will make it worse and then I will get an infection. And I know that's what's going to happen to me.
Yeah. Look, fair.
I don't know, but I know. We don't know, but we know.
We don't know. Yeah.
Anyways, moving on. Severe pain becomes just bad periods. Chronic symptoms become stress or hormones. It's just hormones.
It's just hormones. You know what? It probably is my hormones, because...
Go and take a Panadol. It is my hormones, you fuck. Doesn't mean that it's not legitimate.
Correct.
Anyway, so the patients wait. They push to be seen. They advocate for themselves. They go from doctor to doctor trying to be heard, until eventually they find someone who does not dismiss them, someone who listens, someone who validates.
And they're so exhausted from going through all that bullshit that they're like, oh my God,
they're
finally.
Fatigued, they're burnt out. Someone who finally gives them an answer. And in that moment, that trust carries so much weight, and it's built on years of not being believed.
Yeah.
You know what I mean? You're just so desperate. So when that doctor says this is severe or this needs surgery, patients are going to jump on that.
Correct. It's finally someone is listening to them.
Finally. Yeah.
And then they, because they're so exhausted, don't ask all the right questions or get all the facts, or
they often
do
don't
their research.
know what to ask.
Correct.
As well. Yeah.
Like, if you don't have any medical knowledge and a medical person tells you, hey, you have a severe endometriosis and you need a surgery and I'm going to book you in the next sort of month, they're going to be like, oh my God, finally an answer to my questions, like my pain, and like, oh my gosh, we're going to get it fixed.
Yeah.
I was saying, someone's believing me finally.
Yes.
Which is a big thing.
It's validating, because women aren't often believed, and when it's a man,
correct.
Validating. Anyway, when trust is built on relief and validation rather than clear, consistent evidence, the line between necessary treatment and unnecessary intervention can become blurred. Not because patients are naive, but because they've been conditioned to fight so hard to be taken seriously. They don't expect to have to question it, and that's the part that stays with you, not just because of what happened, but how a system that can dismiss women for years can also fail them in entirely different ways once it finally listens. You know what I mean? It's failed in all aspects. Patient safety is never just one person, it's a team.
Correct.
And this is the main takeaway I want you to take today, guys. If you're on a fucking team in healthcare, a group of qualified, capable people who are supposed to feel comfortable enough to speak up, question, clarify, and challenge. But that only works when the environment allows it. When a surgeon carries that kind of unchecked authority, when confidence tips into ego, it changes the entire dynamic of the team.
Yes.
You feel it almost immediately. The hesitation before someone speaks, the side eyes between the staff when they say something a bit off, the way questions get softened or not asked at all.
Yes.
Sorry.
You're fine. You're not pre-syncable again, are you?
No. I'm what? No.
Don't make me use medicine degree today.
I'm fine. Because I don't even know what that was. Anyway, because no one wants to be that person, the one who slows things down, who gets shut down, or the one who gets remembered not in a good way. You know, that whole group dynamic, that psychological fucking phenomenon where you don't want to be that guy.
No.
So instead, people adapt. They stay quiet. They double check things silently instead of out loud. They convince themselves that they must know what they're doing. The other person, that is.
Yes.
It's called authority bias, reinforced by fear and group conformity. And it is how a toxic culture is formed. Not through one big moment, but through hundreds of small ones, where speaking up feels just a little bit harder than staying quiet. But in healthcare, silence is dangerous, obviously. The system is designed with the understanding that humans make mistakes. That's why we have timeouts, checklists, counts, cross-checks.
Protocols. Policies and procedures.
Correct. They only work if everyone participates, though.
Yes.
The moment one person becomes unchallengeable, those safeguards start to weaken.
Yes.
The Swiss cheese, you know.
Holes for things to slide through, and if those holes line up in just the right order, something gets missed.
Yep. A misstep doesn't get called out. A discrepancy gets second-guessed instead of voiced. A gut feeling gets ignored. And sometimes nothing happens, but sometimes it does. And when it does, people look back and realise someone noticed, someone hesitated, and someone almost spoke up. That's the real danger of a God complex in medicine. It erodes the very thing that keeps patients safe. A team that feels empowered to speak. Because the safest operating theatres aren't the ones with the most confident surgeon. They're the ones where everyone feels safe enough to say, wait.
Yes.
The end. My voice gave out at the very end.
Hey, at least you made it to the end.
I made it to the end.
But no, yeah, a situation where someone doesn't feel safe to say something is more dangerous than having the most experienced person in the room. 100%.
Yeah. And that's something that I've lived through. Like the surgeons, I don't know what it's like really on the ward. I've only ever done placements and stuff. And I can understand doctors can be, in general, intimidating to approach. I found that in my placement in ED, they were less intimidating to approach. They were more willing to work as a team, to discuss things, to hash things out and to take your suggestions.
Yes.
But it really depends on the environment.
It does. And I think that's one thing I'm grateful for where I work is that we do have that. It's very much a team dynamic. We're a team working together to look after our patients. It's not, I'm a doctor and you're a nurse. Some of the new interns, when they come down, they're a little bit like that.
Ego.
But it doesn't take us long to rope them in a little bit.
This is the way we do things here.
Correct.
Yeah. And that's a good culture.
It is good. And I'm like one of the reasons why, even though I do sort of a little bit of agency nursing and I've sort of looked at branching out a little bit, I'm like, I don't think I'll, like, unless I leave Melbourne or I move very far away from where I work currently, I don't think I'm going to leave unless something was to happen because I like the culture that we have and the dynamic and that the doctors, even the most senior consultants that obviously when I was a grad I was a little bit scared of, but now I know I can go to them and ask a dumb girl question or be like, why are we doing this? And so many of them will educate and explain, or if I say, hey, I don't think that's the right approach, they'll be like, great, let's talk about it. And we have that safe, like, comfortable work environment where we can do that, or if something's happening we can be like, stop. We can do a stop and step back and check in with everybody. And like I had an incident the other night where
I was going to ask because she mentioned when she came in that she had 2 nights after night shift where she came home crying and the cat comforted her.
Yeah, my cat, she's very sweet. She's arsehole, but she's sweet when she wants to be.
It's not uncommon in healthcare to have those days.
No, and it was just 2 awful nights in a row. And I think that was what compounded everything. But like the second night, we had, I was working in pediatrics and we had,
a small patient.
Not quite so small, teenager, but, still a small patient. Had a medical event and we were working the medical event and obviously, we press the staff assist, all the staff come running in. We had one of our ANUMs jump in and take over and take control, which is great. We need a team leader in those situations.
Yes.
But she's a very polarizing personality.
Oh, God.
And the medical episode it didn't bother me at all. Like, it was a long one. It took a while. This patient went to resus. That itself didn't bother me. It was how I was treated during the scenario that happened that affected me.
Yes. Can understand.
Correct. But we had one of the other critical care nurses who came in and she checked on me, and I think she could tell I wasn't okay.
Yes. And
she said to me, like, are you going okay? And she's like, that was, a pretty awful situation. I was like, the situation, like, the medical episode was fine. It was everything else.
Yep.
And she offered me a moment to go step outside. I was like, no, I'm good. I'm just going to keep writing my notes on this, on this other patient. And then she just kind of looked at me in a way and she's like, do you need a moment? And I just, like, welled up. And I was like, actually, you know what? I'm just going to go step outside for a minute. She's like, you go outside. And so she came and took over my patients, my area for a little bit. The other nurse that I was working with was also very understanding, and like they let me go outside and have my little cry. I came back in, she's like, you good? And I was like, I'm good. She's like, do you want to have a chat later? And I was like, no, I think I'm okay. No. And then like another doctor came in, we were talking about some stuff, and like she's like, you keep looking at me like, are you good? And I was like, actually, maybe we will have that debrief later. And we never got there, bless her. She tried, like, shit just happened that night. There was stuff happening everywhere that night. And then when we went to leave at the end of our shift, there was more stuff happening.
Everyone was done.
And they were busy. They were not in a place to have a debrief right there in that moment. My favourite educator had come on. I was like, oh my God, let me have a chat with her. She was then also dealing with this other medical episode. So
much happening.
So I just gave that nurse a note, and I was like, I'm good, don't worry about me. Like, I don't want you to go home and like stress and panic about me. Like, I'm good. I'm over it. I went home, I slept. I haven't worked since. I don't know if that's a good thing or a bad thing.
But it's probably a good thing.
It's probably a good thing. I've had a couple of days off. I've got a bonkers weekend this weekend with training for Team Australia.
Yes.
And then a couple more days off, and then I'm working over Easter. So
and
over Easter
and
my birthday.
When do you go to America?
I leave on the 17th of April.
Okay. So that was a lot to take in.
That was, sorry. But just
I feel like you just spoke for 100 miles an hour.
Probably.
But I definitely, I caught it all.
Dad who's going to tell me I spoke too
know.
fast again.
My dad's just like, she speaks too fast.
I do. My best friend and I, we send voice messages back and forth to each other, and sometimes I will listen to it to make sure she can hear me, like if I've been walking or something. Yeah. And I'm like, I talk so fucking fast.
You do. Your brain goes fast. That's why. That's a good thing.
It does.
So, question.
Yes.
In this medical event, did you find that you were a bit scattered?
I was. I went from knowing what I needed to do to everyone came in and almost like, and I don't think this nurse meant this. I genuinely don't think she meant to, but it was kind of like then the talking over me, pushing me aside, made me feel like I didn't know what I needed to do, even though I knew what to do in that moment. And I'd started doing it, and then she comes and says, all right, someone do this, someone do that. And it was never, she never called me out. It was never a, what are you doing? But it just made me.
Her behaviour.
Yes.
Yeah.
And I genuinely don't think she meant it. I think it's just her personality. Correct. It's just who she is. And obviously in a medical event, like
and
there needs to be.
Is she the manager?
She is one of our managers.
So she was trying to lead maybe.
Correct. And she was the nurse in charge that night.
Yeah.
And a medical event like that, it does need a team leader. It needs someone to take control and be like, here's what we're doing. Here's what's happening. Absolutely. Like that needs to happen.
Yeah, definitely.
And it will often come from someone more senior, especially more senior than me.
Yeah.
I'm just a regular schmegular RN. I'm not critical care trained.
Yes.
I'm not.
Yeah. Yep.
Like, and I have knowledge gaps, and this is the other thing is I have a lot of anxieties and insecurities about my job and my knowledge gaps. Like I didn't go to a great university. I did it through COVID. And I started uni in 2020. So we started in the, doing uni normally and then having to adapt and changing how we do things. I didn't go on my first nursing placement until towards the end of my second year. So I did almost 2 years of study before I actually got to physically be in a hospital looking after patients. And then I came in, I did my first rotation in general medicine, which is fine. I think that's a great place to start as a grad because you learn a lot. And then I came into ED. Yeah. And so I went from gen med to emergency, which is a big jump. That's fine. It's a big adjustment. Anywhere to emergency really is a big adjustment unless you did something like ICU. But even then, it's still very different. And I know I'm missing a lot of knowledge gaps. Yeah. Like I know there's a lot I don't know. I also know I'm not expected to know everything. Yes. But a part of me is like, I am a little bit of a perfectionist as well. And I want to know everything and I want to do things right. I am a people pleaser as well. So like I want to make people happy.
Sometimes sometimes the culture doesn't allow for mistakes though. No. I feel like people don't, whilst they say it's always okay to have, knowledge gaps and stuff. Yeah. If you sort of present that in person, a lot of people in the field make you feel small.
Correct. And I think that's just like a blanket nursing thing, like everywhere you go. Like even though I will hype up where I work and say
you're great.
They're great. And like there are lots of people that I can go to and ask my questions to. Like some of the consultants, a lot of the crit care nurses I know I can go to and be like, hey, why are we doing this? Or like help explain this to me. The education team, they are incredible. And a lot of them are really understanding. They know my neurospicy brain. They know my anxieties, my insecurities, and they're well aware, and they have been supporting me through it for the 2 years I've been there, which is incredible. But there is just this blanket overarching thing with nursing where it's like, well, you need to know everything, and why don't you?
And especially with ADHD, like you have really bad rejection sensitivity and terrible imposter syndrome.
Terrible.
So sensitive about being seen as anything less than amazing.
Correct. And just like I don't like,
or just adequate. You know, we don't have to be seen as amazing. I'm, overstating that fact, but it's like, I hate people thinking less of me, and I always think it as well. And I always feel like someone thinks something about me that's not good.
Correct. And like also like the other part of it is I want to give patients the best care they can, and sometimes I'm like, but I'm looking after them, so are they getting the best care they can?
I know. And there's so much, should I even be in this job?
Correct.
Am I even good enough to be a nurse?
Correct.
Yes.
But I know that like if
everyone is the same, surely.
Correct. Well, you'd think so. And I do know that if I was having dangerous practice or like my knowledge wasn't up to scratch, or if there was concerns about how I'm nursing, someone would have pulled me up. I'd be told, I would be on a PIP, or I would, people would be saying things to me, and it's never once been said. And the people that I have spoken to, like when we do our check-ins once a year to be like, how are you going? What are you thinking? Where are your career goals? All that jazz. Because we do that once a year. Someone would say something to me, or I would be pulled up in advance.
I've never been pulled up for my practice except for my attitude and my social media.
Thankfully, neither I did get pulled up for my social media in my grad year, and then I stopped and I got scared.
Yeah, you did good. You did good. Yeah, it's something that you shouldn't go into unless it's really something. The main thing, it's your plan A. This is my plan A.
Fair.
My plan A is my plan B.
Yeah.
I saw that on TikTok the other day with another nurse creator. She was like, this is my plan A, nursing is my plan B. And I was like, hard relate.
Fair.
But yeah, it's hard because to let go of that.
Correct.
As well. Like,
correct.
I'm getting to the point where I just want to quit because I just hate it.
Fair. And it's not for everybody. And
it's because of that culture.
Correct.
That one person can't change.
No.
And I'm
and
overwhelmed
then there's
by that.
We are in a bit of a healthcare crisis right now where we don't have enough staff. So we're all overworked, underpaid, being bullied in the workplace.
Yes.
And people are burning out.
Yes.
And there are so many nurses leaving bedside.
It's been that
they're
way
like,
since
we don't
the
have
pandemic.
enough nurses, but also they're not doing enough to support us. But that's a whole other thing.
They don't care.
They don't care about us.
No, they don't. Private hospitals especially. Sorry. Not sorry.
Yeah.
It's true though. They allow, they don't allow, but
like it happens.
They have, it happens. So what's up?
And that's just the healthcare industry as a whole.
Yeah.
Like there are some places that are like doing their best with what they can, but it's not that healthcare service, or it's not that particular ward or environment. It is the healthcare system as a whole, as it has been for many, many years.
That's it. Well, thank you very much for the insightful and useful conversation, my darling.
You're very welcome anytime.
I wish you a wonderful trip and a safe return.
Thank you so much. If I make it back from the States, I'll come back on and tell everyone all about it.
Yes, and I want a video.
You'll get a video.
Please.
There'll be two. There'll be a cheer routine and a dance routine.
I wanted to share your fucking cheerleader page, but it's like a private one, is it?
Probably. I will unprivate it so you can share it.
Go public. Come on, queen. Your pictures are so cute.
I will unprivate it so everyone can... I might have already done it, actually.
Yeah.
Yes. At Hey It's Kay on Instagram is
so cute.
My cheerleading page, where I will be posting all about my upcoming trip to the World Championships.
Amazing.
Follow along.
That'll be awesome.
My beautiful team. We are the Adaptive Abilities program. So...
Ooh.
Members of our team have disabilities or impairments, and
really?
we work together to create cheerleading routines. And there's dance teams as well. So I'm on one of the dance teams, and we compete against other teams of the same. So in the adaptive abilities divisions, and hopefully win a gold medal.
That'll be amazing. manifesting a win for you.
Thank you very much.
Thank you very much for listening. You can follow our Instagram at Nurse Ratchet Podcast. Yes.
Just think about it.
I had to put a video. Did you listen to my story on Insta of the woman who fucking tried to get in my car?
Yeah.
I'm not going to tell it here. I'll tell it maybe next episode. But like, go and look at it on Instagram if you're interested. But that fucking blew up, like blew up on Instagram, and now we've got like 500 followers on Insta. When we only had like 100. Barely.
Okay, slay.
Yeah.
So almost getting assaulted has done you great.
I mean, yeah.
Hey, almost.
It's all meant to happen.
Yeah.
And I had my doors locked, so.
That's fine.
Anyways, thanks to our subscribers, Laura and Jess. Your support means a lot to us. Someone's trying to call me.
Not right now. We're busy.
If you would like to support the show and its continuation and for me to leave nursing, I would really appreciate and love you for the rest of my fucking life. You can subscribe. What'd you say, what?
I said, I'm not leaving nursing, but I'll still come visit the podcast.
Yeah, that'd be a mess.
Yeah.
Yes, I really want to. I'm doing an MUA course. If you want to see me do makeup, follow my Instagram at GeorgeKate or my TikTok at GeorgeKate.
It stresses me out how good you are at makeup because I am not.
I'm getting better. But again, imposter syndrome. I still think I look like shit.
No, you look fucking incredible. And then I like look at what I do and I'm like,
crazy.
Yeah, cool. To be fair, I do like dance and sheer stage makeup like more regularly than I do anything else. So I was like,
it's like all or nothing type makeup, isn't it? It's like really bold.
Correct.
Oh, God.
And I hate paying makeup prices.
I know. So fair.
Up until like probably the last couple of years, I've always just bought like really shitty makeup.
That's so fair.
And I'm like, why doesn't it work the way it does on the YouTubers?
That's half the problem. Lighting. That's why. Lighting and filters. All right. Well, thank you very much for joining us. Next time you'll probably present and you'll be telling us about your trip.
Great.
Love ya.
Love ya.
Bye.
Bye.